All right. So welcome everybody. My name is Sharon Holly, and I am a yoga therapist. So grateful to be here at this conference and to be here this afternoon, specifically talking about yoga as therapy. So some of you may have been here earlier and got to experience a little bit of the breathing work that we did. There'll be lots more of that coming up in this conference. So I wanted to start with the idea of yoga. So I'm so used to teaching, I'm gonna let you know this is a little new. I've been teaching a lot online since March, but it's been very interactive where I can see my students and they can talk back to me. So this is a little new. I've done some classes like this. So in this moment, just to express that so you know what's going on for me, but I know a lot of people might be new to yoga and coming to this conference, and people often say to me when I say that I'm a yoga therapist or yoga teacher, they'll say, oh, I can't do yoga. I'm not flexible. And my hope today is to demystify what yoga is, right? So many people think you have to twist yourself into a pretzel to be able to do yoga. And that's so not true. Yoga is movement and breath. And sometimes it's just breath. And if we're alive, we all are now, we're breathing, right? And so that is the yoga. And so I find that when I first started doing my teacher training, I'm just going to give you kind of a little history, and then I'm going to kind of explain a little bit what I'm going to do here over the course of this month to offer you lots of different experiences that you get to try out. And so when I first did my teacher training, I found out that yoga in India was really therapeutic. And it was originally taught, my teacher way up there, not that I studied directly with him, but I have studied from his disciples. His name was Krishnamacharya. And he had students, and his students at that time were young boys in their 20s. And one in particular came in and he was like hyperactive and was moving around all the time. And so Krishnamacharya gave him a very precise practice, like make sure that when you're standing, your legs are straight, your arms are straight, check in with your shoulders and be here and be stiff. And he wanted to try to take this young boy and have him settle down, okay? And that kind of became a lot what we call Iyengar yoga. Then there was Pattabhi Jois, and he was bouncing all over the place, and he just could not calm down. He was trying the straight yoga, he wouldn't do it. So Pattabhi Jois, so Krishnamacharya gave him this routine where he would go through downward dogs and, through a whole vinyasa flow. Many of you know yoga as downward dog and flow and all that. And those two particular types of yoga were given to these two young boys at a particular time. And then that ended up translating over time through their disciples to what yoga, many people believe yoga is here in the United States. And then it became a lot of a business and all this stuff about yoga. And it's amazing in so many ways because it really got the word out there. And I think people, when they come to yoga, they come maybe for the exercise part of it, because I hear that a lot. Oh, yoga, I need to move. But there's so much more. And that's what I hope to offer you. And I didn't find out how much more it had to offer until my experience with breast cancer. So it's like this unfolding. But I do know that there are many people that are new to this practice. And so I'm going to be doing little bits in between sessions, and I'm going to be offering longer sessions with different topics. And we're also going to have, starting next Wednesday, and this is all in your agenda, but starting on Wednesday afternoon, we're going to start a daily practice. And I'm just remember the title for it is living, where is it? No, you know what? I didn't write it down, but it's living well. And it's to create a daily practice, a daily yoga practice for yourself that we'll do over the course of 10 days. And I'm going to keep repeating stuff, and I'm going to make it exactly what you need to help you get what you need out of it, right? So those of you, again, who were here earlier, my motto is take care of you. So in any practice that we're doing, I'm going to keep inviting you to listen to your body, listen to what your body needs. Sometimes people think you come into a class and the teacher has all the answers. We don't. We're always exploring. And therapeutic, or I should say, when I think of yoga therapy specifically, it's one-on-one. And it's where I do a whole assessment with somebody in front of me, and we work together to find out what that person needs. So I can't kind of blanket across and say, well, because you have this symptom, then this is what's going to work for you, because it might be different than the other person that I gave it to. So it's really an exploration. Now, obviously, here I'm going to be teaching group classes, and I do a lot of that because I do want to be able to access a lot of people and think that there's so much benefit that can be done around yoga that you can explore on your own. And so for me, yoga as therapy, yoga as a therapeutic benefit, right? How can we use it? And yoga is body, mind, spirit. It encompasses everything. It's lifestyle, right? It's the way that we walk. It's the way that we move. When we're cooking food, how are we standing over the stove? When we're washing the dishes, when we go to sit down, when we go to stand up, just paying attention to all these little nuances of things. And we talked this morning a little bit about mindfulness, right? And that's what yoga, it's mindfully coming back to the present moment and then being in the body. And sometimes it's really hard, and I totally understand that. And sometimes we need to check out a little bit. So when we're doing our yoga, where can we find a place within ourselves that is comfortable? And so that's going to be a question I'm going to ask you each time we come to our mat. You can do it in a chair. You can do it on the bed. You can wherever you want to. I have students doing it outside, which I love, because then I get to have the experience of what we call co-regulating and regulating my nervous system. And so that is, I think, of sort of the big umbrella of yoga as therapy. It is regulating our nervous system. And I have a workshop coming up, I think it's on Monday, called Navigating the Nervous System. I'm going to talk a little bit more about that. But the general idea is that our nervous system is like in charge of everything in our body, right? How we feel pain, emotions, thoughts. I mean, it's all tied together. And so is yoga, physical, mental, emotional. You hear we talk about all that time. You can't separate them out. And I think that sometimes, we're just looking, and there are amazing medical professionals out there that are there to help support us with just one area, because that's their specialty, right? And so if we have a pain in our foot, we go to the foot specialist, right? And they're going to help us with that, and they're going to help relieve pain for us. And that's what we want to do. And I think of yoga therapy as kind of looking at the cause. What's underneath it? What might be maybe the way we're walking? Maybe it's related to something emotional that's going on for us, right? And we know that having metastatic breast cancer is very emotional, and there's a lot of variety of feelings going throughout the day. And so managing those, how can we help support ourselves, right? There's fear, there's anxiety, there's concern, right? And then when we come to something like this and we're hearing a lot of information, there might be some overwhelm. And so recognizing that for ourselves and going, okay, I'm going to take care of myself right now. Maybe I just take a big breath. So I just said a lot of words, right? I said a lot of maybe triggering words. So why don't we all just take a nice deep breath in through the nose and out through the mouth. If that felt good, maybe do another one. I was doing that this morning when I was having trouble not being able to get my video going. I was like, okay, there's nothing I can do. It's out of my control, but what can I do? I can breathe. And so I hope to share that with you. Sometimes it's easier to access those moments, sometimes not, right? But just to give you, little ideas of what yoga can support us in. I mean, it's pretty much everything. And I don't want to say it heals. That's not something that we say, but it supports. It supports and provides quality of life at times when there's struggles going on. Tomorrow afternoon, I'm going to be talking about the lymphatic system and how yoga can support the lymphatic system. We know that can be compromised. And over the weekend, I'm going to talk about other side effects such as neuropathy, right? Neuropathy is one of them. sometimes nausea. Fatigue is a big one, right? Fatigue. How can we help our systems? And so I'm going to focus in on all of those as we go through this time. So I really hope and encourage that you can come to whatever parts of it you feel ready to come to. Okay. And remember, they're all recorded, which I'm so happy that you can go at any time to view these videos, because I think there's going to be some great nuggets. As I heard Sharon talking before about the exhibit halls and how some of us, and me included, are still figuring out how to do all that stuff. So I do plan to have like chat times and questions and things like that available to you this month. I'm just figuring it all out, as we all are. But that's why I'm grateful to at least have these to start with. And I know there's ways. I've already seen some messages. You can send me messages in this Huva. So lots to explore. And it's really an exciting way to know that reaching so many people and community and bringing it together with like minds and people who understand. So that's kind of just like, again, a little snippet. As each time I'm here, I'll give you like a little heads up onto what's coming next. I'm also going to be talking about how yoga can support you with sleep, with physical pain and flexibility, strength. All of these areas can be supported by that. But it's all about meeting you where you are. And because I'm meeting you over the internet like this, and I can't see you, I'm inviting you to meet yourself where you are. So don't try to push. And that's the beauty. I love this part too, because you can't see other people. So we don't have to try. I know myself, when I'm in a yoga class, I'm like, oh, I want to do what they're doing. Or, I will demonstrate some stuff, but please don't feel like you have to do what I'm doing. I'm going to give variations and offer variations. But one of my biggest variations, for those who take classes with me know, is rest. Sometimes you might just all of a sudden be like, I'm tired. I just want to rest. And at the end of my practices, I might say, stay there if you want to stay there. I mean, I will say that. You get to decide if you want to stay there. We used to, when I was teaching, think about it in person, everybody had to get up at the end, roll up our mats, get in our cars, go back wherever, right? There's so many silver linings in this opportunity. And, I do miss, believe me, I miss seeing people and working it one-on-one and seeing people in person and really being able to guide that way. So there's a little bit of that, that's missing. But for here right now, we're going to make the best of this. And there's so much to offer. It's endless. So, we're going to have these starting, like I said, Wednesday, we're going to have these 10 days of this daily practice. So that, I believe it's 2 to 2:30. I'm going to have a Q&A a little bit on Wednesday if you have any questions. But then every day for 10 days, you'll know that's the time to be with me. And again, it'll be recorded. But if you're able to, know then that's your time. Or if you're doing the recordings, see if you can make it the same. And that's how we start building little habits, right? Daily habits. And we do brush our teeth, right? We wake up every day, like just to build maybe a little bit of yoga into our days. And it doesn't have to be a whole 30-minute practice, by the way. This is just something we're going to get going on. We're going to have a little break after the 10 days, and then we're going to do another 10 days for those who are like really gung-ho. And in between, I'm going to ask, questions and see what you noticed. And if there's something that you're looking for, maybe there's something that I didn't address, or, just to really help to bring it to what you need. So I guess with the Q&A, when we do have those will be available on the chat. I'm going to figure all that stuff out too. I know Sharon's going to help me with that. But there'll be opportunity. I want this to be, I want you to be able to participate. I want to be inclusive in this. And, it might mean that in between we do some breakout, these exhibit hall rooms, chat rooms, and I find out from you information. So I'm really, really looking forward. And so I think I've talked enough now about yoga as therapy. I think I'm hopefully covered everything that I was thinking about in this moment. But again, I did want to say, I did think of the immune system, right? It's really important. The immune system is super compromised at this time for so many of you. And that when we come into our yoga practice and it helps us regulate our nervous system, right? So that's our in our system. And again, I'm going to do this more on Monday, but I can't talk about yoga without mentioning this a little bit. are at rest at our base level, we are in what's called social nervous system, and we're able to be curious and open-minded and usually in an even mood, maybe happy, and all that. And then, when things happen in our lives, whether, the plethora of things, it could just be in a moment. It could be something we read. It could be something we hear, all of a sudden, boom, our nervous system might go into what we call fight or flight. And that's our body's mechanism. It's an automatic response to take care and protect us. And so that could be emotional, it could be physical. And in that moment, maybe our heart starts racing and we're noticing our muscles are getting tight. And so as this is happening, our body is trying to figure out, can I fight whatever's happening to me right now, or can I run from it? And if it can't do either of those, it might go just into freeze mode. And in freeze mode, it's just, I'm done. I can't do anything anymore. I've ever felt like overwhelmed. I just cannot do one more thing today. And then maybe we start losing things or being forgetful. And so these are all these things. I'm going to have some handouts on these. I'm going to put in my exhibit hall. So you're going to be able to start to notice in yourself, oh, I'm moving up, and we call it the stress relaxation cycle. So it's a cycle. We go up and we come down. We go up and we come down. And that's natural. That's normal. Our body's going to do that. We cannot remove stress from our lives as much as so many of us would like to, but we can help our body to process the stress. And that's what I feel my job as a yoga therapist is, to help you. But first, we need to build the awareness around all of that. And so when we take care of our nervous system is what's sending all the messages to our body, right? If we have pain, when we're thirsty, when we're hungry, when we need to go to sleep, all these messages are going on. And so if we can regulate our nervous system, then we're going to decrease our pain and sleep better. And then our immune system overall is going to be in a much better place. So I'm hoping that makes sense. It's just, again, it's this large body of information that I'm trying to kind of bring down to just a little bit for you during this conference. And so that was my introduction. And now I thought maybe we'd experience some of the possibility that the yoga practice can offer you. So once again, as I said before, this is, such a personal practice, and you're all individuals. And so however you want to be, and I'm realizing I'm standing here because I tend to sit a lot in front of the computer. You might choose to sit during this. You might choose to stand. We're just going to do some breathing techniques and a little bit of stretching and moving. Again, just kind of like a little introduction. We have about 9 more minutes or so to go. So in my portion with you today. So I'm thinking about, I guess, well, we're in California. I know not everybody is in the heat right now, but we are. But I do know that many of the treatments will cause the side effect of heating up the body, right? And so having hot flashes or night sweats or, those type of feelings where inside out, we could put on a fan, we could put on air conditioning, but maybe there's a way, and there is, to cool the body on the inside. So I've been teaching this in my classes this week, and it's called Shitali breath, and it's spelled Sitali, and it's pronounced Shitali, like a sheet, ali. And what it does is it cools the body off on the inside. So I've practiced this at times during night sweats. I've practiced it at times when I'm feeling a little feverish. I'm like, oh, not sure what's going on. So I invite you to play with this. And again, if you like it, feel free to take it with you. I'm going to bring it into other days as well. So if it doesn't work for you, then skip it. So I'm going to start with, let's see, I'm going to walk up closer to the camera because Shitali is done in a couple of different ways. I know it's probably the light's going off with me now, but if you can curl your tongue like this, then curl your tongue like that. Okay. And it is genetic. So I will say that not everybody can do it. So don't worry about it if you can't. Okay. The other way you can curl your tongue is like this. So I'm curling the front of my tongue over towards the back. Okay. If you can't do either of those, then we're going to do straw breathing into the mouth, just like that. So see which of those makes sense for you. If you looked up Shitali breath or Googled it, the traditional way is one of those tongue ways, but I believe it's also shown with the straw breathing, right? That's how I teach children, right? We're breathing through a straw. And so breathing in like that, feel the temperature as the air moves in through your mouth. Notice. Do you feel it's a little bit cooler? So breathe in there and out through the nose. Now, if your nose is stuffed up or for some reason it's not comfortable, breathe out of the mouth, okay? So that's my instruction to you. Overall, breathe however is most comfortable for you. I'm going to teach you some again, yogic techniques, but make them yours, okay? Make them for your body. So we're going to do a little bit of this Shitali breath, however is best for you, and see if you can find a nice, slow, long breath, okay? So just breathing in, I'm going to do the straw breathing here, and out through the nose. If you want to close your eyes, you're welcome to close your eyes. Notice how that feels in your body. I'm going to do the tongue now. Okay, so as we do that Shitali breath, the breath's kind of going in here, right? And it's starting to go into the mouth, maybe into the throat a little bit. So again, if you were to Google this, I just like to show you the traditional way is to gently tilt the head up as you breathe in and then come back down to neutral as you breathe out. So I'm going to show you what that looks like, okay? So if I'm using my tongue, it's going to be so feel free to join me. I'm going to do the straw breathing now. So notice if you felt a difference between doing it straight and tilting the head. And what I notice is that I can feel as I tilt my head up, the air goes a little bit down, more into my body, into my chest, right, into my whole being. And so see if either of those make sense for you. And you can feel free to do that at any time, like I said, during a practice that we're doing, if you're noticing your body's getting too heated up. If you are, you're out and you're feeling really warm, if you're getting a hot flash or a night sweat, any of those. So that's our Shitali breath, very cooling for the body, very calming for the body. And if it's not for you, not for you, right? The other, well, just in general, I guess I should even start with, in yoga, for those who are brand new to yoga, Ujjayi breathing, U-J-J-A, I believe, Ujjayi breathing is in and out of the nose. And the reason yogis say we breathe in and out of the nose is because we've got those little hair follicles, right? And they help clean the air as it comes in. And then as we breathe out, it helps to actually turn on our, I didn't even say this before, did I? Oh my gosh. Our sympathetic nervous system, which is our rest and digest. I talked about fight or flight, right? Fight or flight is our sympathetic nervous system. And what we do in yoga is we come into parasympathetic nervous system, rest and digest. So when we can breathe in and out of the nose, that will help bring it on a little faster. If we have to breathe in through our nose and out through our mouth, that's fine too. If your nose is stuffed up and you need to breathe in through your mouth, you breathe in through your mouth. Slow, long exhalations like we did earlier are going to help to turn on that parasympathetic nervous system, help our nervous system regulate, bring our body back into a state of balance, right? That's yoga. And I realize I've been talking about mindfulness so much. I didn't even give you the definition of yoga, right? Yoga comes from the yoke, to join, to rejoin the body and the mind. And we do that through the breath. The breath is our vehicle. And I had the opportunity to go to India a few years ago, and I loved the yogi there said that it's actually the therapist. The breath is the therapist between the body and the mind. And I just thought that was so beautiful. So how can you allow your breath to bring you a sense of calm and ease? Now, if taking a deep breath is not comfortable for you, I know that's true for many people, do the one that feels good for you. Maybe it's just focusing your attention on your breath, right? Maybe it's just noticing your breath in this moment like we did earlier. So again, as we said earlier, if it's comfortable for you to close your eyes, maybe close your eyes and just begin to tune into your breath. Notice the breath moving in and out of your body. Notice your body here. Maybe your shoulders, your jaw, and your neck. Perhaps spin the palms out open. Feel a little bit of a opening across the chest and the heart. And as you're focusing on your breath, whichever breath feels comfortable for you, maybe just turn your head from side to side. Eyes can be open or closed, just to get a little stretch into the neck. Right? Maybe looking from side to side, perhaps tilting the chin towards the chest and looking back up. Just moving the neck and the shoulders. This is something that you can do throughout the conference, throughout your days. When the chin comes to the chest, maybe making a little half circle. Using your breath. So one more tip here before I have to go. And when you find an area that feels really tight or tense, or feels stuck, take a nice big exhale. So I'm going to go ahead here. I'm going to roll my shoulders now, forward, up, and back, to open up across the heart. So I'm going to take a nice breath in through my nose. Maybe sigh it out. And again, in through the nose. One more time. And then bringing the palms maybe together at the heart center, over your heart. And taking a moment to just check in with you. Notice how you feel in this moment. I hope there's something useful that I've given you. I hope that I've given you a nice kind of explanation of how yoga can be therapeutic throughout this conference in general, and then throughout this conference. And if there's anything I missed, I'm sure I did. Feel free to send me messages. I know that you can send me messages here. Personally, those who know me, I know you have that access, and I really look forward to more yoga as therapy together with you during this conference. And with that, I say namaste. Wishing you peace and ease. Take good care.